February is American Heart Month, and according to the CDC, heart disease is the leading cause of death for both men and women. In tonight's Health Beat, we are hearing from a Georgetown man who survived a heart attack and his doctor, who want you to be aware of symptoms and how to prevent heart disease.
I guess about mile 10 into the ride, began to feel some pretty severe discomfort in my chest and down my left arm and everything.
That was on Father's Day of 2021. Russell Hartsfield, an avid cyclist who was 65 years old at the time, was on a planned 24-mile bike ride when that pain forced him to stop and call his wife.
By the time we got home, from my wife picking me up, the pain had subsided. It had not gone away by any means, but it had subsided enough to think, well, maybe this thing's going to go away like it did a few days ago.
So Hartsfield went to a luncheon his daughter had planned, but when the pain didn't go away, he went to Heart Hospital of Austin at St. David's Round Rock Medical Center, where doctors determined he'd had a mild heart attack. An angiogram revealed a 90% blockage in one of his coronary arteries, and doctors inserted a stent.
Russell did everything right. He knew, he listened to his body. He knew something was different. He knew that there was something probably not right here, and he came in very quickly. Had he waited longer, things may not have gone so well.
After Hartsfield's procedure and rehabilitation,
I began to sense another amount of energy that I've not had. And so I've been on several rides back up 20, 25 miles since that time.
Now Hartsfield and his doctor, Jay Pandya, want you to know your risk factors for heart disease. Even though Hartsfield was very active, his included high blood pressure, high cholesterol, and a family history of heart disease. Dr. Pandya says other risk factors include diabetes, obesity, and tobacco use, and it's important to manage them.
If you have high blood pressure, treating the high blood pressure. If you have high cholesterol, treating that. Same way with diabetes, changing the lifestyle when it comes to obesity and exercise, giving up smoking, that's a huge deal too. So these are modifiable risk factors that can make a huge impact on the chances of you developing heart disease, even if you develop them in the risk factors in the first place.
And when it comes to heart attacks, know the signs. It's not always pain.
Anything that's new onset in that regard, so new onset of chest pressure, new onset of shortness of breath, things that are exertional or kind of worse with exertion are always concerning to us. What we also tell patients is if you feel like it's weird or if it's worrisome to you, you need to take it seriously.
As for Hartsfield, this father of 3 and grandfather of 5 is managing his risks through medication and lifestyle improvements.
Now we're finding more salmon and more other things on the grill as opposed to some of that cow meat. I'm probably going to retire pretty soon, but at the end of the day, I want to be able to have more days to go, to be able to enjoy some of those things with kids and grandkids and my wife for a bunch more years.
Dr. Pandya says there are some landmark studies that show if you can make it to middle age between 40 and 50 without picking up one of those risk factors we talked about, your chances of heart disease become incredibly small. But even if you don't have symptoms of heart disease, men should be screened by a cardiologist at age 50 and women at age 55, especially if it runs in your family.